Now look at some observable features or some things that could occur in bones. So you mostly pick them up on X-rays. So this is what is known as the subchondral sclerosis and also cysts. Okay. So subchondral sclerosis and also cysts. Okay. Cyst formation. Okay. Also sclerosis. Okay. So they could form on X-rays. Okay. So you should know that there are classical radiographic findings. You see them in what? Degenerative joint disease. Them themselves, they're not really disease conditions. But if you see them, shows you that degeneratives, like things that were there, are kind of like wearing off. Okay? So that's what we got. So most notably, they occur in osteoarthritis. So they reflect that there's changes in bone, just beneath the articular cartilage. So subchondral sclerosis, now talking about it to be particular, it's coming in because there's increased bone density. So the bone is becoming too hard. So imaging of the bone is showing that the bone sides, the sides that are affected by the sclerosis, are whiter than other sides. So you have thickened whitish areas, most common in weight-bearing joints like the knee joints, okay, or spine. So pathophysiology is because of chronic mechanical stress leads to microfractures and bone remodeling. There's increased bone deposition as a response to cartilage loss. So clinical significance is there's what it indicates that there's what osteoarthritis. Okay. So subchondral cysts now. So fluid-filled cavities within the subchondral joint bone, okay, adjacent to the joint. Okay, so that one is basically fluid-filled, right? So there's round or oval radiolucent, that's dark areas beneath the joint surface. I see this area appears darker. Okay, so pathophysiology is synovial fluid is now intruding into bone through cartilage defects. Okay, bone necrosis from mechanical stress and microfractures is also associated with the progression of osteoarthritis. So that's what we got for subchondral sclerosis and also cysts.